My name's Imogen Watt. I'm one of the junior surgical registrars currently at North Shore, but I've worked across all three hospitals in the Auckland region: Auckland City, Middlemore and North Shore. I am from Auckland. I was born and raised here, but I actually whakapapa te Ngāti Tū Whare Toa, and I did my medical school in Auckland, and then I also did my clinical years between Auckland, Whangarei and Tauranga hospitals. I chose to stay in Auckland as a house officer initially because I had family here and I wanted my whānau support as I was stepping up from the medical student to doctor kind of transition, and then I stayed here as a registrar because I had a really supportive group of mentors around me and friends, and so thought it would be good to step up in an environment I was comfortable in. Auckland region has 3 tertiary hospitals that offer a range of training opportunities to anybody who's interested in surgery. There's a diverse range of surgical services here, so you've got access to plastic surgery, urology, pediatrics, cardiothoracics, vascular, as well as general surgery and orthopedics. There's a lot of high-level tertiary care with complex surgical cases that you can be exposed to as a junior registrar and also as a trainee. There's a lot of mentorship and support because of the close links the 3 hospitals have with the university. There's a lot of academic opportunities to engage in research and conferences, which is very valuable as a junior registrar and a senior registrar. I chose surgery is actually an interesting story. My initial degree was in population health and public health, and I always saw myself working in that area. But in my 4th year as a medical student, I did a general surgical run and I just fell in love with the team dynamic, the really close relationships that you had with your nurses in the operating theatre, the anaesthetists, your surgical team, your ward-based cares, and I really enjoyed how general surgery takes care of their patients right from diagnosis to the end of their cares. So that was what initially drew me to surgery, which was a U-turn for me in my career. Working across the Auckland region, you've got 3 main hospitals, but you've also got a 4th smaller hospital with Waitakere as well, though they don't offer surgical kind of acute services. You've got Middlemore, which is based in South Auckland, Auckland City, which is in the centre of the Auckland CBD, and North Shore, which is in the North Shore by the beach across the bridge. They all have their own patient populations and demographics, and they all offer, I think, something different to the junior doctor. I've rotated through all of them I'd recommend. Middlemore would be our highest need population. They have the higher percentage of Māori and Pacific Island patients, lower SES patient group on general, and people present often with quite acute and progressed pathologies. It's got a high workload, but because of that, Middlemore has an incredible, in every team that I've worked at, their team connectiveness and focus as people really work together and pull together. You have a lot of access as a junior doctor to the bosses and a lot of direct consultant support, which is something that's really valuable. Auckland City Hospital is the most closely linked, I'd say, to the University of Auckland, so there's lots of opportunities to get engaged with academic research if this is something you're wanting to do, to work with multidisciplinary teams at quite high level tertiary care and provide surgeries such as, during my colorectal run, they have a high-PEC unit where they provide high-PEC chemotherapy to a range of patients who've got complex cancers. So seeing this kind of high-level tertiary care is very interesting. On the flip side, you've got North Shore, which is the hospital over the bridge. North Shore has one of the highest age populations in New Zealand, and of the 3 hospitals, I would say is the most well-resourced with the richest population of the 3. However, it does still have a high Asian demographic of immigrants, and you have to work well with these patients and engage in very multidisciplinary and equitable care. North Shore has got access to a surgical robot, and there's lots of real technological advances that come with it being a well-supported and funded hospital. So, for example, in the last few weeks, my team here performed a robotic esophagectomy, which is something that I'd never be exposed to at the other 2 hospitals. So being able to see that level of care was very interesting as well. My advice for somebody that's wanting to participate or look into a career in surgery would be to get involved early. I think that surgery is a fantastic career. There's lots of avenues that you can take within the 9 surgical specialties held by the RACS College in Australasia. I'm obviously a general surgical non-training reg. Stay late for cases if you can. Try find a number of mentors. Try find a mentor who is a few steps above you. That might be the non-training or training registrar who can help you with practical advice about things that you need to do to get yourself ready to apply for training, such as research, CV points, teaching opportunities, volunteering. You also probably want to find a mentor who's quite a few steps above you. That's the fellow or boss relationship with someone that you can consider having discussions about what the career is like for them. I have a number of mentors in this area, some of whom are within general surgery and 2 of whom are not actually general surgical consultants, but they're surgical consultants in different specialties, and I find those very useful. I think that my proudest moment so far as a doctor is that I'm entering my 4th year. My partner and I just bought a house in the Auckland region, which is really exciting, as we've done this with no parental support. That's been really nice to have a beautiful space to call our own and to set up our garden and have our friends over for dinner parties. So that's been a very relaxing, non-work related proud moment. And I think one of my proudest work-related moments so far is that I've been involved in volunteering for Whakapikiaki, which is a outreach program to encourage Māori, Indigenous people of New Zealand who are high school students to consider careers in healthcare. And I got involved in this as I was part of MAPAS, which is the Māori and Pacific Admission Scheme, when I was a medical student. So I went through that program. And I recently had one of my Whakapikiaki students get into medical school, which was a really nice kind of whole round moment. And I've had some of the MAPAS students that I tutored as well become some of my junior doctors, which has been really lovely to see that.